my name.
So pursuant to Chapter 20 of the Acts of 2021, this meeting will be conducted via remote means in accordance with applicable law. This means that members of the public body as well as members of the public may access this meeting via virtual means. This meeting may be accessed remotely via Zoom as posted. When required by law or allowed by the chair, persons wishing to provide public comment or otherwise participate in the meeting may do so. Additionally, the meeting will be broadcast live in real time via Westboro on local cable, Verizon Channel 28 and Charter 192, and their online platforms, westborotv.org and youtube.com/westborotv. What I was hoping to do today was summarize the last Board of Health meeting and events from last week, review the CDC guidance, show some graphs of local data, hear from the rest of the board and members that we've asked from the school department here, and also to discuss guidance or proposals, and finally end up by mentioning something called Mass Notify. I think that we have 2 members of our board in the meeting right now. We are still waiting for Dr. Ehrlich to join.
He's here.
Oh, he is here now?
Yes.
So I was going to start with the summary of the last Board of Health meeting and events of last week. On 11/15/2021, Westboro Board of Health had a meeting. The sound was very soft, and so I encourage everyone today to try to make sure that you can be heard. When I looked on YouTube, it looked like the first 8 minutes of the meeting was missing. We began the meeting and we're discussing sanitation and health inspection before we started to discuss issues related to COVID. Jen, our Director of Public Health, was working on logistics of a vaccine program for 5 to 11-year-olds. The head school nurse was to give out a link once we were ready, but it was the vaccine program was for the following day. We had a limited number of volunteers, so I did not go into work that day, and instead I volunteered 8 hours at the 5 to 11-year-old clinic. We were expecting about 100 people, and there was another clinic from the state that was scheduled for 11:15 from 4 to 6. We were expecting to give out about 200 vaccinations. There was a discussion on COVID-19 case trends. Superintendent Bach was not present. Massachusetts trends were alarming. Regional trends were okay, but they weren't going down. Westboro numbers were largely stable, some up and some down each week. Most spikes go up and then come down, but our recent spike went up, but didn't quite go all the way down. Westboro seems like it might be going slightly down or holding flat, and I was expecting an increase in the past 2 weeks. This is of that meeting. We did not get that. Competing with the upward trend from cold weather and more indoor time is the vaccinations and prior infections that might keep the numbers lower. If our current protocols and vaccinations were keeping things flat at that point in time, during the time where I was expecting a spike, then it should be better in the future when the cases are in a plateau or when they were expected to be in a plateau. Dr. Marr was predicting higher numbers and a surge to come. Guidance for schools based on state and local data was discussed next. The school department had a meeting scheduled for November 17th, and implementation of flexible masking might be the week after Thanksgiving or before Thanksgiving at that time. Dr. Marr expressed concern over flexible masking and thinks before Thanksgiving is too soon. Dr. Ehrlich also thought before Thanksgiving was too soon and that a review of data post-Thanksgiving should be done to decide policy post-Thanksgiving. Dr. Ehrlich also thought the school committee was in the best position to balance the relative risks unless things became worse. We all agreed that before Thanksgiving was too soon for flexible masking, that Amber's plan with 5 days of masking after each break was reasonable, and we were split on the guidance we were providing to recommend after Thanksgiving. A combination of no flexible masking until we have more data, and to allow the school committee to make the decision unless the data changes, where the Board of Health would jump in to put masking into place. There was a question that was raised: could a vaccinated student who is exposed go to school without a mask? The CDC recommends 14 days of masking post-exposure. Policies in many places like DESE are based on data prior to Delta, when there were very few breakthrough cases. I think at that point we recommended that they should wear masks after exposure, and we asked our director to find out what is the nurses' policy in Westboro. And so we can come back to that in a little bit. For the December meeting, our director asked if we could be flexible so that we could do clinics and also have a December meeting only if we needed to. Potential dates were discussed of Monday the 13th, and it was a tentative date where we could change it if needed. And so then on November 17th, the school committee had a meeting where flexible masking was not implemented before Thanksgiving. On Tuesday, December 1st, the town manager, in consultation with the director of public health and the fire chief, released a mandate to require masks in certain municipal buildings. These included the Forbes Municipal Building, the public library, the senior center, the fire department, and the Department of Public Works. And this was regardless of vaccination status, and it was to go into effect Wednesday, December 2nd, and was to remain into effect until January 10th. In addition, employees and town boards were asked to conduct meetings remotely if they were able. On Wednesday, December 2nd, the school committee voted to implement flexible masking in schools on December 6th. And they did this through an approval process from the Department of Education. On Thursday, December 3rd, I spoke with the director of public health about cases in Westboro. I was alarmed that we spiked so fast. As I considered the need for an emergency meeting, I asked the director to post it immediately to give the public as much notice as possible. As we started to get public feedback and continued to discuss the risks and benefits to holding a meeting on Thursday, including talking to town council, I decided that because it was going to be a remote meeting without the ability for the public to speak, that allowing additional time for the public to give feedback was both important and consistent with open meeting laws. It was this balance between the need for swift action and the need for public feedback that made me decide to have the meeting tonight, December 6th. During the past week, I've received a total of 177 emails, although some of them contained multiple letters, forwarded from the Director of Public Health, as well as several non-email based messages. I've read each and every one that came in before 4:30 p.m. today. I want to be clear that the Board of Health and the school department are communicating. I've talked with the chair of the school committee multiple times on Thursday, and also have had conversations with the school superintendent. They were both invited here tonight. I want to assure the community that the Board of Health solicited feedback from the community to make sure we did not overlook particular personal situations or data that we should be aware of, but that we do not conduct a poll or otherwise shape our view based upon the number of respondents. Most of the people who did communicate with us specifically mentioned the schools, and unfortunately, this is being portrayed as one board versus another. Nothing could be further from the truth. Each of us is acting with the information we have at the time that we're making our decisions and are making the best decisions we can at the time. The situation can sometimes change rapidly, and we do wish to make sure that we move in an appropriate manner. And I want this meeting to focus on overall town safety and to give guidance to individual groups as possible. Before I go into CDC guidance, I just wanted to give Dr. Ehrlich and Dr. Marr a chance that if I misquoted something or you don't feel something was appropriate, that you have a chance to jump in.
I just wanted to clarify the date, the January 10th plan was from Superintendent Buck. That was at the school committee meeting prior to the last one, correct?
Yes. Yep.
Yes.
I didn't know if I should answer or not. That was discussed on 11/17.
Thank you.
So I do want to just review the CDC guidance. On July 27th of 2021, the CDC released updated guidance on the need for urgently increasing COVID-19 vaccination coverage and a recommendation for everyone in areas of substantial or high transmission to wear a mask in public indoor places. even if they are fully vaccinated. The CDC issued this new guidance due to several concerning developments and newly emerging data signals. First, a significant increase in new cases reversed what had been a steady decline since January of 2021. In the days leading up to the CDC's guidance update, the CDC saw a rapid and alarming rise in the COVID-19 case and hospitalization rates across the country. In late June, the 7-day moving average of reported cases was around 12,000. On July 27th, the 7-day moving average of cases reached over 60,000. This case rate looked more like the rate of cases the CDC had seen before the vaccine was widely available. Second, new data began to emerge that the Delta variant was more infectious and was leading to increased transmissibility when compared to other variants, even in some vaccinated individuals. Given what the CDC knows about the Delta variant, vaccine effectiveness, and current vaccine coverage, layered prevention strategies, including wearing masks, were needed to reduce the transmission of this variant. At this time, as we build the level of vaccination nationwide, the CDC must also use, or the CDC is recommending that we must all use all prevention strategies available, including masking indoors in public places to stop transmission and stop the pandemic. Everyone who is able, including fully vaccinated people, should wear masks in public indoor places in areas of substantial or high transmission. So that was the guidance the CDC released on July 27th. I do have a couple of graphs that I would like to show, and if you can bear with me, I will try to show those.
It was posted.
Okay, bye.
Bye.
Get this up, I apologize. I have host disabled the participant screen sharing. Is it possible for me to get screen access? Is that you, Paula, that's able to control that?
She's looking at it now.
Okay.
All right, screen access. Hey.
So maybe what we can do as well, Paula, you're working on that. If Dr. Ehrlich or Dr. Marr wish to give some additional comments, I know that Dr. Ehrlich, you had written the report that went out on Friday. If you want, I could read your heading, or if you want to either summarize it or read it, that might be appropriate too at this time.
Sure. It just takes me a minute to pull it up. Give me 1 second. So just to give a little perspective before I get to the comments, these comments that accompany the report were asked for by the Board of Selectmen when we first started doing these reports. And as I do them, I try to extract what I think are the most important aspects of the data each week. And then sometimes trying to put into context of a regional, national perspective, and then trying to emphasize what I think are proper educational messages coming from the Board of Health. These are not meant to be political in any way whatsoever. They're not meant to be controversial. They are meant to be as objective and informative as I'm able to do. And I hope that is how they're seen. And so with that, the most recent report, I'll just read it as follows for those who have not been reviewing these. We have once again had a marked increase in COVID-19 cases this past week. This refers to data we had as of December 2nd. There were 78 new cases reported, compared with 57 cases the prior week and 34 the week before that. There were no new deaths, but we have 2 individuals in the hospital, which is the first time we've reported anyone needing to be hospitalized in a very long time. There were 40 new cases in those who are unvaccinated and 38 breakthrough cases. It is worth keeping in mind that according to state data, approximately 95% of the population of Westboro has been vaccinated. So the rate of COVID-19 in the unvaccinated population is currently 20 times higher than those who have been vaccinated. The number of new cases is now similar to what we were experiencing at the previous height of the pandemic. This increase reflects what is happening in both Massachusetts as a whole, as well as the rest of the country. Interestingly, Massachusetts has seen an increase in cases lately that is growing faster than the rest of the country, but the increase in death is at a much slower rate than the rest of the country. This likely reflects that those who have been vaccinated can still get COVID-19, but when they do, they are much less likely to get severe disease. This, combined with a higher rate of cases in those who are unvaccinated, underscores the need for getting vaccinated, and for those who have been vaccinated to get booster doses when indicated. In addition, other things to consider that can decrease the chance of spreading the disease include social distancing and the use of masks when in indoor settings. This is especially true in crowded situations or in places with poor ventilation.
Thank you, Alan. And so I do now, I think, have control to show a graph here. In orange is last year, and then in blue is this year. And one of the things that the CDC was talking about was the nationwide decline that started in January of 21, and that they're looking at the data, they were starting to see a nationwide uptick in July. We had, for a period of time here in Westboro, had kind of up and down numbers for a good portion of the fall. And now we're actually looking at numbers, the 3 ones that Alan had just read off, were this uptick in cases that can be seen kind of especially around December of 2021. And as Alan was saying, that our prior maximum number of cases that we had seen was in December of last year. And we are rapidly approaching that. I think that the number of cases was 78, and that's, right around this 10 cases per day. We did put in place a metric of if we had more than 10 cases in a week, that was our threshold to switch from monthly reporting to weekly reporting. And so those portions of time, you can see less dots in blue over the summer, where we only had reports made once a week because we were below that threshold. As we started to climb above that threshold, we shifted into a policy where we started to have the reports asked for each week. And so I think that that is the summary of data that I wanted to show. I'm going to stop sharing that now. And I do want to give both Dr. Ehrlich and Dr. Marr a chance to, speak about their feelings. I do want to, before I do that though, make a note that we have received a lot of feedback. We do not have the time to read everybody's email, and I think it would be inappropriate to directly read a few emails and not read most of them. And so from that point, I'd ask the board members to try to avoid reading individual emails. But certainly, if they want to talk in generalities, they can.
I just want to be clear. You mean, when you say read emails, you mean as part of the public meeting? Because
sorry,
I read every
absolutely.
single one of those emails. Okay.
What I meant to say was read them out loud during the public meeting.
Yes.
Rather than, I expect everyone to read them.
Yes. Okay. Just clear.
Thank you, Alan.
I have some comments. Is this a good time? Can you hear me okay?
Yes, we can.
Yep.
Sure. I wanted to first thank our director, Jennifer Sullivan, and Paula Cavino for forwarding these emails to us all weekend, and I mean all weekend long. Almost 180 of them, and yes, I have read them as well, and including phone messages and emails. And while I don't necessarily feel decisions like these that we are discussing should be based on community opinion, they should be based on numbers and science. But hearing from people has been very important. And I would like to say that overwhelmingly, the emails that we received, over 140 of them, were concerns regarding the quick change to start flexible masking today. We heard from very concerned teachers, nurses, and I did want to make that point. While a lot of the community I'm hearing from is asking how the Board of Health let this happen. And I did want maybe our director or you, Nathan, to kind of mention how, with the process, how flexible masking kind of started in the schools today without the blessing from the Board of Health. At some point, I think that needs to be commented on. A lot of people are asking, why maybe we didn't meet sooner than today to have this discussion. And I did want to comment on that as well. We did not have a meeting set, and obviously that's why this is an emergency meeting. People are asking maybe why we didn't meet before the vote last week. And my thought is that according to our superintendent, the plan for flexible masking was January 10th. And I felt that from the meeting last week, it was an abrupt change in the date and a rush of flexible masking. And initially, I thought we as a Board of Health had time to look at the numbers that were coming to us. And before that January 10th date. So I felt like that is the reason we hadn't had this meeting sooner. There have been obviously a lot of changes in COVID and the numbers, since our last meeting, and even since the school committee adopted the decision to have flexible masking starting today. And I did want to comment on all of those changes in COVID since, our last discussion, our last meeting. Obviously, Omicron has entered the picture with a lot of question. We still don't know enough about it and the consequences of it. The numbers have in town, as you mentioned, have increased more than 100% since we last met last week, being 78 cases. Which is a daily incidence rate of 34.4%, positivity of 3.4. I have heard that we now have 3 residents hospitalized, 1 being a child. The cases have gone up also more than 100% since our last meeting, and to over 5,000 cases a day.
Excuse me, Melissa?
Yes.
You're not coming through completely clearly at times.
Sure.
If you could-
Thank you.
That helps. That's much better. Thank you.
Thank you. Sorry. The state is having days of more than 5,000 a day. Percent positivity in Massachusetts is close to 5%. ICU beds in Massachusetts are at 82% full, which is higher than the national average in the 70s. Hospitalizations are up. Last week, there were 23 cases in our schools, which is the highest that I have seen in 1 week. I can certainly be corrected if I'm wrong. 4 in the high school alone. And as of Friday, there were 393 close contacts that were identified in our schools. I did want to comment on some discussion in the school committee last week before the vote. I just think it's important to mention. and has been reiterated by a very vocal minority of community members. There has been repeated discussion of the fact that flexible masking is strongly supported in our community. From the emails, and I know this wasn't a survey of our entire community, but certainly from the emails that I received, that was not the case. There's repeated discussion in the meeting last week that masks aren't working and masks aren't needed, and the scientific data does not show this, and I'm happy to direct people towards the CDC website that has a very large summary on the importance of masking and how there are no detrimental effects of masking. There's repeated mention, and a very significant time was spent on the mental health of our children suffering. And however, there is no data to support that masking impacts has a negative impact on mental health. Many of our town social workers and psychiatric professionals have reached out to us to reiterate this. People to argue about choice, and kids should have a choice to mask in school, but children don't have the choice to go to school. We don't have a remote school option, and I think that's important, again, mention. At the last meeting that we had that you summarized, Nathan, the three of us unanimously agreed that flexible masking before the holidays was not recommended. And we all agreed that waiting until after the holidays was the best idea, which included Christmas. I'm not sure, that isn't what you mentioned, but I think that is what we unanimously agreed upon, excuse me. We also discussed that if the school committee did vote to start flexible masking, there would be ongoing discussion with the superintendent and Board of Health regarding the numbers in the school and in the town and recommendations on when to remask. And it does not seem like, well, I don't know if that is happening. Nathan, you told me that you have been in communication with everyone, but today was the decision to start flexible masking, yet we had significant numbers of cases, and it would have been a good time to discuss whether or not that was a good decision for the high school with the cases in the high school. Furthermore, the DESE guidelines that gave us this choice to flexible mask specifically state whether or not school or district avails themselves of the 80% vaccination off-ramp is a local decision to be made by school and district leaders in consultation with local health officials. And I felt like our school committee members last week did not follow these guidelines by DESE by going against both the superintendent and the Board of Health to decide to flexible mask starting today. Lastly, I did want to mention some concerns that I repeatedly heard from the many emails that we did receive. And again, I wanted to thank people for reaching out. There were many concerns about the unknown of Omicron. There were concerns that many of the students in the high school and in the middle school are more or close to 6 months from their second vaccine. And has that been discussed at all? Many are asking if anyone's asked the students what they want and what makes them feel safe, anxious, or scared regarding masking. Since many people have mentioned that some teachers didn't even get a chance to get their booster because they were very surprised by the date changing to January 10th. People have commented on how, or some teachers have commented on that they're not necessarily aware of what students in their classroom are to be masked or not, because as far as I have heard, our teachers aren't being given lists of who should be masked or not, but I can be corrected, please, if I'm wrong. And I do have to mention, I'm sorry, lastly, that it was very disappointing to hear and see a small, very vocal subset of residents in our town act so incredibly disrespectfully and egregiously on social media, personal Facebook messages, and emails regarding this issue to the point of personal insults and even threatening remarks. And I really thought our town was better than this. So we are volunteers, we're physicians. The reason I took this position was because I care about my town. I care about the residents in this town and just want to keep our town and students and residents safe without any personal agendas. But thank you.
Thank you, Dr. Meyer. I'd like to turn to Dr. Ehrlich and give you a chance to give some comments as well. And then I'd also like to hear from Superintendent Bach and School Committee Chair Kristen Vincent, in case there's anything that they want to say before I give any more remarks.
Thanks. So first of all, I want to start by thanking everyone who sent in comments. The fact that we have to do this as a virtual meeting and preclude people from being able to show up in person makes it more challenging to get feedback on decisions. Much as Dr. Walsh had said, it's not that we are swayed by which perspective has the most people advocating for it, but when people talk about their situations, you get to hear perspectives and things that you may not have thought about that are important to consider in decision making. And so the wider the input, the better. With close to 150 emails that I have read, when I go to town meeting, it's rare to get 150 people who want to talk about anything. So this is a situation where I believe pretty much anybody who wanted to weigh in on this and make sure that their point of view was being heard, if you sent in an email or a message in some way, that you were able to do that. And I think I feel very good as a board that was able to take place. And again, Nathan, thank you for rescheduling this over the weekend so that we had that opportunity for the input. One of the things that comes up a lot is when people talk about science and science is this or science is that. And I think it's easy to feel that the people who have a different perspective than you do, meaning everybody, including me, okay, well, it's because they're just not listening to the science. And I want to be clear, science only gets you so far in these types of discussions that we have to engage in. Science can tell you what the transmission rate is, or science can tell you what our current case rate is, or, within, to some extent, there's some data on how effective are masks or things like that. Those are scientific questions. Should we have mandatory masking in all public places? Should the schools be having flexible masking? These are not strictly science questions because they involve values. And values, two people can look at the same set of data and come up with different opinions. And by way of example, a couple of years ago, this board had to deal with an outbreak of EEE in Massachusetts, and we passed some rules and regulations. And science can tell you that EEE is a devastating illness, that either you're going to be dead or very likely to have severe neurologic injury if you get it. And so we took some actions, and that's pretty clear cut of something where there's not a lot of debate on how awful that condition is. On the other end of the spectrum, you have things like the flu, and we know we've lived with the flu for a long time, and that some people get vaccinated, some people don't. Flu is a problem that we manage and we live with. And COVID is somewhere in between. Okay, it's certainly much more serious than the flu, and it's not as serious as EEE. Okay, but it's much more common than EEE. And so, what rules we pass in town in order to help try and protect public health? It's a balancing act of what are the competing interests? How does this affect a business, or how does this affect an individual who has to comply with whatever rules we promulgate? There's a lot of value decision making in there, and so it's best to articulate, in my opinion, what you believe in and why, rather than to accuse the other side of being emotional or not listening to the science or being irrational or illogical or things like this. And there was a fair amount of that. And I understand that's how people like to perceive people have different points of view, but I'm trying to share the perspective that I bring to this. It is my belief that masks are one tool in slowing down the spread of diseases that can be communicated by droplets or respiratory secretions. Sometimes we need all the tools available. Sometimes we only need some. And so sometimes masking should be part of that equation. Sometimes it shouldn't. Where you draw the line, again, sometimes comes down to your values. But I don't think when people think, well, masks don't work at all, sometimes this is because people will say, if you ask a question, do masks prevent the spread of SARS? No, they don't prevent the spread of SARS. They reduce the risk. If you by prevention, you mean stop at 100%, no, it doesn't do that. And neither does vaccination or anything else. So what we're talking about with this disease is how do you slow the transmission till we either get more effective treatments or more of the population is naturally immune, or there's mutations that are less virulent or whatever. But if we're at a point where we need to try and slow transmission, masks definitely need to be part of that discussion. Where they fit in, under what circumstances, that's part of it too. When we first didn't know what was going on with COVID early on, new disease, we had people masking outdoors. Now we believe masking outdoors doesn't matter. It probably doesn't. Okay, fine. So we evolve as the data changes. We should change how we think about it. And that I think applies to some of the stuff this evening as well. One of the things that I think is important, and Dr. Mayer addressed this in terms of some of the social media stuff. I will tell you, I'm not on social media. I don't pay attention to social media. And I know by reports that sometimes people can be kind of not nice on social media. Okay. And I think it's extremely important, especially in a small town like Westboro, that we treat everybody with courtesy and respect as much as possible. Yes, people will feel passionate about certain issues, but we need to, for us to be successful in managing COVID, we need to maintain a sense of community, that we are all in this together. And that's extremely important. And it extends to public health in general. For us to succeed as a board of health, a health department, we need people to trust that we are making decisions based on what we believe is in the best interest of the community and nothing else. We're not being swayed by the loudest voices. We're not being swayed by emotions. We are trying to take everything that we hear, filter it through a lens of good judgment, and then make decisions. By the way, I'll say it's easy to also always think our side's in the majority, the other people are a loud minority, one way or the other. And again, I try and stick just to what is the logic, what's the rationale for whatever policy position somebody happens to be advocating for. But getting back to the importance of maintaining trust, our health department has to maintain the trust of all the citizens of the town. When we talk about contact tracing, when we call you up, we need you to be honest with us and help us do the work that we need to in order to help keep everybody as safe as possible. And so I don't want this board, I have differences of opinion with my board members at times. We are still one board. We come to one decision and we work together. And I hope that everybody who's listening to this or watches it later understands that we all as a town need to come together. Yes, we may have difference of opinion. Decisions will be made. If we don't like them, we can argue for them to be changed or whatever. But ultimately, it's not going to do well to be divisive. That's I think the most important part of what I wanted to get across this evening. I will say, just to reflect on some of the stuff about the school committee, my feeling at the last meeting was that the school committee is in the best position to balance the risks and benefits of the policies around masking. That and to a certain extent, I still feel that way. I will say that at the time we had that meeting, and I think Dr. Walsh accurately described this in his opening remarks, the data had sort of been bouncing around in terms of the number of cases, and there wasn't any clear direction. And it wasn't clear if we were going to have an upturn, as Dr. Mayer had suggested, or maybe it was going to tail off. And since that time, and again, the graphs that Dr. Walsh has presented show the case counts really have gone up dramatically. And while I still believe that school committee is the place where most of these decisions should be made, I will say that, you know, my attitude is when facts change, my opinion changes. Okay, I try and respond to what's the latest data, what's the most accurate. We, as a board, as Dr. Merritt said, suggested waiting till we got a little more data after the holidays to see, was there an uptick? Maybe it might be because of behavior around Thanksgiving. It looks now like Thanksgiving may have had little to do with it because the uptick seemed to start before Thanksgiving, but then just accelerated. And so maybe it was Thanksgiving behavior, or maybe this is happening because of things like people's immunity waning over time, or new variants, or who knows what. It could be any number of things. But it's clear that the case rates have gone up quite substantially, both in Westboro and elsewhere. And so, you know, that's the kind of thing that I hope the school committee was taking into consideration when they were making their decisions. And obviously, I'm anxious to hear what representatives from the school committee or the superintendent have to say in that regard to help explain so that people understand what's the rationale. Again, we make decisions, fine. We've always said, both here and with the school committee and the board of selectmen, that we wish to be data driven. And I would say lately the data is going in the wrong direction. So that's, I think, everything I need to say right now.
Thank you, Dr. Ehrlich. I appreciate that. And in the spirit of, you know, having the boards and the groups within town work together, I think that we can present some professionalism and cooperation between the groups. And, you know, I value the relationship that we've had with the school committee and the school department, between the nurses and our staff. We've had excellent, really excellent working relationships. And I want to see that continue. And so in that vein, I've asked both Superintendent Bach and Chairwoman Kristen Vincent here. And I would love to get some input from you guys, having heard what we've just said, kind of what feedback you've gotten from the community. And before we make any proposals or anything like that, I think it's important just to kind of hear from you two.
Sure. Thank you so much. Kristen and I will share comments. I'll, do an overview and then also I'm sure she'll chime in. As always, it is a pleasure to be here because I think I can't agree more. And I really want to echo our reiteration about our strong, strong commitment to partnering with the board. We would never have been able to move through the last year and a half successfully without the strong partnership and caring, respectful relationships that have been shared between our boards, the ongoing work with our nursing staff, collaborating with you to answer questions and to manage what has been a very, very complex stretch of life for our community and our nation and our world. So I want to reiterate that all the things we've always said to each other remain true. I think that for me right now, it's very important tonight. The goal of kind of giving you a synopsis is for our current plan to find a strong path forward together using our current masking changes and support each other in making that successful. Again, that's how we've managed everything we've shared. I do want to clarify a couple of key pieces just to make sure that we're keeping our information shared. There's a lot of reiterating of information around meetings and things. I want to clarify that the school committee and I are in full agreement and have complete confidence in the plan and implementation for the protocols of what we have in place to move to more flexible masking. That was never under any disagreement or in a difference of opinion. The difference solely centered on the discussion around the date. And I want to be clear, because I made the recommendation, that my recommendation is a recommendation and the school committee votes, and we share a relationship in that journey. When we came to the Board of Health, when we went to all of our other meetings, December 6th was the date that they had held as the point of conversation. So it was always on the table for discussion. It should not have been a surprise to anyone. I think my request to wait until the 10th was the surprise. So I was struggling to make that decision. I put a lot of time and energy into it. And I want to be clear on record with the board that my decision to recommend the January 10th date was not based on any fear of the data. And I will reiterate a couple key data points around how we have done with regard to readiness at Gibbons in the high school to move to flexible masking with regard to cases. And for me, and I did state this at our meeting on the 17th, and again on the 1st, I guess was the 2nd, my recommendation was grounded in looking at exactly what you're experiencing in all these emails. You're hearing from a bell curve of perspectives and experiences that people have around their views around flexible masking and where the data stands in the community. And you'll hear more strongly from one side or the other based upon their satisfaction with your feedback or their dissatisfaction with your feedback. So for us, when I looked at lots of conversation, looking at the meetings I'd had with you and the discussion points you gave us, as well as talking with the nurses, talking with the administration and listening and worrying and all my own particular perspectives, I recommended the 10th because I felt it gave time for everyone within that bell curve of experience, students who weren't ready, faculty who might not be ready, community members, and families to all have a set date and work to that moving forward place. Some people feel that was a violation of the goal of the 6th, which they thought they had understood. And that brings us to the level of complexity we've faced in the last week. But to be clear, that recommendation from me was grounded in relationships, not in any concern that we couldn't move forward because of data. Currently, to date, we have had 16 cases all year at the high school. We've had 1 at Gibbons. We have currently faculty, we've had good management of contact tracing. And I feel that I would reiterate that the move towards flexible masking, which we started today, is possible with the strong shared relationship we need to have in order to monitor it now for data and responsiveness. And I'll talk about that in a minute. For me right now, I want to be clear that the implementation is in place. We moved forward today, and just as we did over the last year and a half, we will adjust together through daily conversation, which we've called out in our protocol, a strong shared relationship where we will speak with you each day and each week around our data to interact with the director and the board as needed to get guidance from you around the best recommendations to either remask a class, remask a building, or to take a change in direction, looking at the trajectory of how things progress as we move forward. I feel strongly that it is essential that I reiterate that that is exactly how we've managed it over the last year and a half, and we will continue to do so. If we come to you and we're in a call with Nathan or Dr. Ehrlich or the whole board or with Ms. Sullivan, we are going to ask the questions and share the current case and get information and guidance from you in partnership. And together, I have confidence that that data will ground the decision making. I think that we're in a good place to move forward. I have confidence in us as a team, and I feel confident that, you know, I'm never comfortable when I feel like there's I'm such a middle of the road person, and I'm a non-controversy related person, and the emotional turmoil over my worry about how to implement leading me to recommend the 10th, causing this level of anxiety and disagreement in the community is not something I'm comfortable with. So I'm hoping and clearly stating to you You know, the date of the 6th was always on the table. The school committee owns that implementation date and had the right to vote that change. And my recommendation also had a right to stand. And, you know, together we've worked forward always as a strong committee. So we're here with you tonight in partnership, and I'd be happy to answer any questions and talk through, you know, what you need from me and from us as a board.
Thank
So,
you, Amber.
thank
I
you.
appreciate that. Ms. Vincent, is there comments you'd like to make?
Yes, thank you, Dr. Walsh. And I appreciate you starting off this meeting by setting the tone of cooperation and collaboration. And I will kind of agree and reiterate what you had said about this is not a board against a board. This is actually boards coming together to do the best work that we can here in Westboro. We were clear that we were always going to use our waiver that we worked towards, that parents and students work towards by getting vaccinated. We were clear that we were going to apply for it, and when we got it, we were going to use it. The question was when would we start using this waiver to have masks optional for staff and students? And as Superintendent Bach said, December 6th was a date that had become a date that seemed acceptable to many, including the Board of Health, when we came to your meeting. I believe that meeting on the 15th ended with Dr. Walsh summarizing, saying that you have consensus as guidance that the schools should mask 1 week before and 1 week after Thanksgiving. And that we would, you know, take it from there, but 1 week after Thanksgiving felt comfortable. I know a lot has changed since then, but that was the guidance we left the meeting with. And so I just want to be clear that I am also very confident in the layered protocols and the mitigation that we have, the mitigation measures that we have in place. We have test and stay, we have lots of contact tracing, and as a school committee, we are committed to putting resources where they are needed. So we're committed to putting resources towards our nursing staff, to help with extra hours or extra staff as needed as cases rise. And cases are rising without masks optional. So we would be providing this type of resource for our nurses anyway. And just to be clear, I am not swayed by the loudest voices. I'm not swayed by politics or a small number of people who are complaining. I am trying to make the best decision possible with the information that we have, and looking to our neighbor at Hopkinton, who has had some very positive results with allowing for mask optional. We can always adjust together. We can always remask a class or a building, like Superintendent Bach said. We are going to take this day by day and work together with you and look to your guidance. And as Superintendent Bach said, you know, move to daily meetings if needed to keep an eye on the data and make adjustments as needed. So thank you so much for inviting us to this meeting.
You're welcome. Thank you. And so the kind of two key items that I wanted to address would be, the first is guidance that we could give the school or the school department in their implementation of this flexible masking. And then also whether the Board of Health thinks that we need to be taking any steps to help address the spike in cases that are happening across town. And now some of those might be at crossroads to each other, in that, you know, one of the things that has come up is the potential for a proposal to look at a town-wide indoor public space mask mandate. And obviously, if something like that were to go through, then it would necessarily have the effect of applying to all public indoor spaces, which would include the schools and businesses and retail and other shops as well. And so, I don't know, Dr. Ehrlich, it looks like you clicked off your microphone. I don't know if that means you've got something you'd like to jump in with.
Well, I wanted to know if we were going to get a chance to ask questions of the school representatives.
Yes, actually, I think that that's probably important and we should do that. There was a question from last meeting as well. And so I don't know, Director Sullivan, did you have a chance to ask the school nurses about that question? You're on mute right now.
Sorry. They actually asked for guidance, and my guidance was to mask 10 days after exposure.
Did
to
you
follow-
actually, do you have the question written down there, or do I need to pull that up? Just if you could repeat the question with
Sure.
your recommendation.
Let's see. Maybe it'd be quicker for you to follow.
Wasn't it for, the question was vaccinated students who were exposed?
Yes.
Right, and
So I
requirements
can
for
speak,
masking.
yeah. Yeah, so since we requested the guidance, I actually know the question.
Okay.
So if you want to repeat the question, Amber, then
It's been a little
Director
bit.
Sullivan can respond
So
to the
this-
advice she gave you,
yeah.
and then the board can chime in case we
Sure.
want to modify any of that guidance.
Sure. So initially, the guidance we put in place, and I know you guys are very thoughtful and have read the protocol planning that we pushed out to families. And it indicated at the time that when you identify a close contact, that unvaccinated students test and stay, but that you have to, for vaccinated students, they monitor for symptoms. And at the time that we stated our protocol, they still retain the opportunity to flex mask during that time, but to monitor for symptoms. There's a range of discussion that occurred around that, and we sought guidance from the nursing staff, sought guidance from the Board of Health to get direction. And so Jennifer provided it today.
So Jennifer, if you can repeat that guidance now.
Sure. I stated that it would, the guidance would be to mask for 10 days after exposure to current dates of quarantine. Because currently right now your quarantine dates is 10 days from exposure. So we don't follow the CDC with this. It's actually a Massachusetts set standard, and that was my guidance.
And in true collaboration, we would accept it. I would probably ask the question around, I believe DESE has set a 7-day window for their tracking rate, and I would have started at the 7 days, and I am certainly open to discussion on that. They actually shortened their cycle window, so it was 7 days. But again, I would defer to you and see whether or not, if you want to work on the 10 days short term and then monitor how we're doing, at some point we might revisit shortening that. I think we're going to have a series of revisits and discussions, which is how this works.
So I have a question. So if a student is vaccinated and has an exposure, they are not asked to get tested?
If they're vaccinated, they monitor for symptoms. They do not get tested.
Because the
That's
current
that's-
CDC guidelines are for vaccinated exposed people to get tested and to mask for 10 days. I know that is different from DESE's guidelines. But so I know that our school is not testing these students, but I would make the recommendation if people agree that students it is recommended they get tested if they're exposed.
So Mass DPH's guidelines is for fully vaccinated is to self-monitor and test if showing symptoms. That is what.
No, but that again, that goes against the CDC guidelines. But I do understand the CDC guidelines are different than DESE and DPH guidelines.
If I can jump in as well, Dr. Marr, and that is that in Westboro, when we look at our local cases and our spread here, about half of the cases are coming from unvaccinated individuals and about half are coming from vaccinated individuals. And with that as kind of background, if we were trying to make local decisions here, I would also agree with the recommendation to the schools that if they have someone with a known exposure, regardless of vaccination status, it may well be worth doing the testing or the test and stay in addition to requiring the mask on those exposed individuals. I don't know if Dr. Ehrlich, if you have additional comments, or then we can go back to Dr. Mara.
I don't have anything in particular to say on this.
So I would say that my request would be to follow the Mass DPH guidance and mask after the 10-day exposure, regardless of vaccination status, as a benchmark. And if you demonstrate any symptoms, you are automatically test and stay and sent home if needed. I want to be careful to manage the burden of the numbers that it takes. The benefit of having vaccinated students is that it allows us to focus on those that are unvaccinated to be doing our test and stay protocol. I would hope that I like the recommendation. I think it makes sense. And I feel like I'm going to get back to our nurses and start there. So I would say the Mass DPH guideline, and we enter into the 10-day, it would let us put out a communication tomorrow that would be clear to students. That would be an update of those, which is at quarantine, or I mean, at close contact identification, all students would mask for the 10 days, regardless of vaccination status, and then monitor for symptoms. I think that would be a strong, clear guideline to provide tomorrow, and I'd be happy to push that out.
Please, Dr. Ehrlich.
Yeah, I'm comfortable with that. I think, if you're masking for 10 days, the likelihood that you're going to be spreading COVID with no symptoms, I think is very low. And so that seems to be a reasonable approach. Again, if you're unmasked, you can theoretically certainly spread COVID, though most of the amount of virus you might be transmitting is certainly going to be less than someone who's symptomatic. One of the problems, of course, with COVID is people don't always know when they're symptomatic. Every time I wake up in the middle of the night and I cough, I'm like, is it starting? And then I wake up next morning, no, it's just my allergies. Okay, so because of that, I think masking is probably the most effective approach there. Yeah, it makes sense.
In the case that somebody wanted a test, and I don't know the numbers that the nursing staff is dealing with, and I know that if 95% of the people are vaccinated, certainly that means that the burden on the nursing staff to do testing is only that 5% right now. But if we were to open it up to either a recommendation that the people go get tested, or that we offer testing if they want, given a known exposure, at least a single test, a few days after the exposure, that could, even though they're masking within the schools, they are going about their lives and with their families and everything else. If there was an exposure and knowing about it might change somebody's behavior, that could be really useful from the community perspective. And so I don't know if other people have thoughts about that.
So I just want to make sure I keep us on track. And this is why this is a good shared process. And I don't want to bog down your whole meeting around this recommendation, because we've worked really hard to talk about your whole community. But regardless, the protocols for access to the test and stay, which is a paid state program, do have guidelines, and we do have to send, record, and report on everything. Nurses have discretion and can apply it if needed, if they believe that they want to check a student, but I would leave it to their professional discretion at the building level, respectful to the amazing job that they have done to guide us through this successfully. And if they need to apply a test and stay, they can. That said, I don't want people randomly coming down to the office to access testing and bog us down. You cannot, DESE is clear that we cannot use test and stay for that parameter. They won't pay for it, and they will not endorse it or support it. So there's a range of things where I feel like, one, I'm leaving here with a strong recommendation that enhances our layers of mitigation, as we like to say. And I believe it'd be a safe place to start and leave our nurses' discretion in place.
There's also the means of testing outside of the schools and communication to students and families that if you've had an exposure, you certainly can contact your
Yes.
nutrition or get tested locally.
Yeah, no, I agree with you,
Yes,
Dr.
and-
Mar. And so we certainly can increase making sure that we are very explicit about that and provide resources as to where they can go. And we do that already. Like Marlborough has a very clear testing site protocol you can access if your pediatrician is bogged down. So we're already actively doing that, and we'll continue to provide that. We've gotten to a place where, you know, those communications are moving smoothly. Thank you so much for the guidance.
Yeah, one of the things that, you know, as a board, we're obviously concerned about is that if the numbers rise, continue to rise, at some point, we could be back in a situation where, you know, we have to think about whether businesses need to close, whether schools need to go remote or hybrid. And, you know, we obviously aren't at the point where we're thinking about closing those schools, but that's a concern that we're worried about. And we really want to try to make sure that the policies we're putting in place are really going to help keep the community at a point where we don't need any other of those measures.
Agreed. I'm not looking to have anybody who gets triggered by weird talking points to get freaked that we're going to close the schools. So let's just reiterate,
Yeah.
our numbers are incredibly good at the building level, and our monitoring and our implementation has been highly successful with your guidance and support. And when we had an issue at Mill Pond, you helped us immediately get engaged and take care of it. Similarly, we looked like we might have a trend upwards at Fales. It is now mitigated back down, and it hasn't had new cases. We are very good at this, working in partnership with you. And I want people to know that I don't anticipate that we would ever re-enter hybrid, you know, or be schooling from home. DESE has us moving forward, and I have confidence that between all of us, we can manage this. So thank you.
Yeah, and as we, oh, go ahead, Dr.
I
Ehrlich.
don't know if you want to finish the thought. I have a question for Kristen, and I just want to get that in before we move too far along.
Yeah, so if I can jump in then, I just wanted to say that as far as the numbers in the schools, obviously, whenever you look at smaller and smaller groups of people, the statistical noise in those samples increases greatly. And so while we can see trends very clearly at the, you know, national, state, regional level, sometimes within town, our data is noisy. And I would imagine that the data from the schools themselves, especially if you're looking at individual schools, can be especially noisy. You know, one family could, you know, all of a sudden cause an uptick that looks large when it's just an individual family. But with that said, you know, bearing in mind that there are statistical noise in there, when I was looking at some of the data for the schools, it seemed like if you look at the number of students in isolation and quarantine, that number has been going up. And I didn't know if you guys could comment a little about those numbers. And I would caution all our listeners not to read too much into it, just because of the fact that we expect more noisy data, you know, when you look at smaller sample sizes.
Yeah, I mean, I would defer to Jennifer to help me on any. We do weekly postings, and, you know, again, like, as I said, across the span of the year, we've had 16 cases at the high school. We've had 8 active cases at the high school currently that are either in quarantine or at home waiting to recover, that are cases. So that's 8 active, 16 total across the span of the year, and probably 4 since the 2nd. So, you know, again, not a massive increase, but yes, you see that. Whereas at Gibbons, under very similar circumstances and same very similar age and disease load, you see none. So, you know, it's all somewhat individual, which is why every conversation, as Dr. Ehrlich trained me last year, is individual to the case and the circumstance. So we can, as you said, Dr. Walsh, astutely, like, look if it's trend within a family or if it can be connected to an event. So I think those responsive discussions, and Jennifer Sullivan's done a really good job to help us do that analysis up close. And I feel like that protocol will continue to serve us very well moving forward. I think right now the hotspot, even, be reluctant to use that word. But I think we tend to get more cases at Mill Pond, but again, that's a very big school. We've had like none at Hastings lately. So again, it moves around in that sense, but because Mill Pond has 900 plus students, and they still have a large number of them who've only had their first dose of vaccination, although they're moving quickly, thank you to everybody's efforts. I think we'll see, that number go down once we responsibly can get the vaccinations picked up. So
My question is it feels like we really need to recommend definitive numbers. And I think the community is looking for as well, whether it's a weekly number per school per case.
I agree. I mean, in the sense of the discussion, I understand that some people want that, but again, I would maybe defer to Dr. Ehrlich and Dr. Walsh, who were with us last year at the height of all of this. And we were very clear that it's really an individual process and that a number doesn't work. And I would say that helped us. Go ahead. Sorry, I didn't mean to interrupt you.
No, I guess maybe I'm not clear. Numbers of cases per school and the decision to remask is what I was getting at. I mean, it's hard to compare to last year because we were masking all year.
So
Yeah,
can I
go ahead,
interject?
Dr.
Yeah. What the conversation that superintendent is referring to had to do with the fact that let's just arbitrarily say there are 10 cases. Okay. Well, how I think about the significance of those 10 cases differs. If there's 10 cases, let's say in a single classroom, to me, that strikes me as we've had a breakdown in our protocol. Our protocol isn't working to keep people safe because you have a cluster. Something went wrong. If you have one person in 10 different classrooms who each got infected, now that's a reflection on what's happening in the community. It may not be as much an issue about spread within the school or things like that. And there are other scenarios you could come up with. But when she is saying that a single number is not something you can pin your hat on to make decisions, I think that's what's being referred to. If I can just go one step further, I think, again, we all have some questions for the school committee. And one question would be, is there a set of data points, maybe as Dr. Mayer is suggesting, case counts per school or something, but is that something that was discussed as to what would be things that might cause you to want to revisit the decision?
Similarly to the way we operated last year is taking it case by case and looking at, like you said, Dr. Ehrlich, whether it appears to be in-school transmission or clusters in certain classes or certain grades versus just kids come to school, they've gotten COVID from their home, their community, their activities, and it counts as a case in school, but it wasn't really an in-school transmission. And so what would cause us to, I think, ask everyone in a school to remask is if we thought there was in-school transmission happening. And so that could be school by school. That doesn't need to be, 4 cases and then all of Gibbons and the high school have to wear their masks for a certain period of time. I mean, obviously we would want.
Yeah, I just want to help with that as well, because Kristen's point is well taken. That's the kind of conversation we are committed to having with you, where we're looking at that data and sharing that discussion, which is how we moved forward last year very well, which is, it's easiest when we're looking at the case to speak about, or the school, or the classroom, or the building. And I think I have confidence that, as I said at the very beginning of this, we are committed to come before you daily or weekly, as we did last year, to seek guidance on any change in numbers that look concerning. And our nursing staff, working with Jennifer and you as a board, navigated that successfully last year. And I think that's the protocol we articulated we would maintain this year and use it to the advantage of moving forward. So, as you said, Dr. Walsh, working in partnership is key. I believe that stood us in good faith last year as we found our way forward.
I hope that answered your question, Dr. Ehrlich.
That question, I have another question for you, if I may.
Please.
One of the things that I think is most concerning to me about the current situation, and you partially addressed this in your comments earlier, and I appreciate that, but I'm going to try and pin you down a bit more and get you to be more explicit. You talked about giving support to the nursing staff, and the single biggest burden, I believe, I could be wrong, I haven't spoken to them directly, but the thing that I worry about most from a public health perspective, put it that way, is the resources to do contact tracing. The CTC has been disbanded, and so basically everything that involves contact tracing either falls to the school staff or to the Board of Health staff. And we've seen situations where I saw some emails from Jen earlier this week. So-and-so, somebody has an exposure, they got 96 contacts that need to be traced. Okay, so you said you're going to be providing support. Can you specify what that would look like so we have an idea of how well we'll be tracking things?
Sure. So I think one of the things that we've already started to put in place this week is more of an automatic phone message that we can send out through our system at the high school and the middle school, so that there could be an automated message sent to 12, 15, 20 people all at once that just gives the basic information that notifies people that they have been exposed and that they are identified as a close contact, and leaving all of the contact information there they need to know, and then phone numbers and things if they want to reach out to the school nurse, get follow-up, talk to administration, things like that. So being able to have a pre-recorded message and hit a button and have it go out to 20 people is, I think, one way that we can kind of, first of all, get the message out faster if there are a number of people that we need to reach, and then also just help with that volume. But I was talking to the superintendent earlier today and saying, like, if we need to hire substitute nurses to make phone calls, I'm certainly willing as a school committee member to put resources with that.
Okay.
I had a question in terms of this same sort of topic, and that's, if we had breakdowns where, either students aren't getting notified or people aren't being contact traced. I know that with the switch from the CTC disbanding, I worry that there's a little bit of, chaos in there, or how well they were doing their job. I trust our staff and the nurses, much more than I do somebody that's, across the state doing contact tracing. But as we offload from them, how are we doing? How's our burden level? Are we able to, handle the cases that are coming in? And I don't know if Jen, if you or any of the staff can comment on that a little bit.
Sure. We have handled all the cases fine so far. We are concerned with the flexible masking of what that will entail for us, because we know they have siblings, we know they have elderly grandparents, and holidays are coming up. So the transmission to household members is a huge concern for us with the flex masking. And we have resources, and I will pull them if needed, for sure. But right now we have it under control.
So I do want to, unless we've got more questions.
Yeah, one more question, if I can. So first of all, there are some communications that have been coming in even during the meeting, and obviously we can't address them specifically. But one thing that has come up, and it was contained within some of the emails over the weekend, and I just wanted to know to the extent to which the school committee may have considered this, and it has to do with the time from vaccination that the Gibbon High School students are. They're around 6 months now. Eligibility for boosters probably will get extended to 16 and 17-year-olds soon, but it hasn't happened yet. And so people have some concerns about that. And I don't know if you want to comment on whether that was a factor that got discussed or not, Kristen.
It is a concern. And when we were sort of thinking about the whole school year, we started talking about mask optional over the summer. Like, let's get back to school. And our original plan, if anyone can remember, all the way back to September, was go to school for 2 weeks, fully mask everyone. And then we had September 20th, like in our heads, like we'll look on September 20th, maybe we can have some mask optional, thinking about where that might happen, how that might happen. And the state stepped in and said, there's a mask mandate and took that away. Since we applied for the waiver, it's been waiting all along. Wait for teachers to get boosters, then wait for younger students to get vaccination. Now, if we wait for the next round of boosters, we'll be waiting for another group to get their booster because theirs is wearing off. There's never a perfect time or a good time to do something like this. This is a time to try it and do it. And I have the utmost faith that we are going to do it safely and carefully. And so it is something that we discussed, Dr. Ehrlich, but it was between January 10th and December 6th, and we decided to go with December 6th.
So I have a question regarding back to, the numbers in the schools. We had 4 reported in the high school as of Friday, 4 more as of today. To me, that's a large number in less than 2 weeks. And
No, just
I
wait,
think
I
there's
just
just a
want to
big-
clarify our numbers, though. I just want to clarify our numbers,
Sure.
please. If 4 since, like 4 additional, not 4 additional since this week, it was since I put the
Since-
note out. Yeah, so we had
Friday.
2 additional cases this weekend and on Monday. So
Okay, I thought
4 total.
someone said there were 8.
No, 8. There are 8 total cases active right now. So we've had, I was going to say 16 again. We've had 16 cases this year at the high school. Currently, they've all cycled through, returned to school, and there are 8 currently that are out in quarantine until they cycle to return. And we've had, of those, there were 6 since Thursday last week.
1 second.
To me, that seems like a large number.
Melissa, can I just get clarification here?
Yes,
When you say 6 or 8, you use the word quarantine, which means you're a contact, not a case. Is that?
no, they're cases. That's
Well, I
what
want to
cases,
get
right.
clarification.
So Paula, can you
16,
make,
yeah.
Paula, if you could make me the host, I can bring up a slide. I've got a graph with isolation versus quarantine, and it might be helpful.
Yeah, I mean, there are 16, we've said we had 16 COVID cases at the high school, students who have COVID since the start of the year. They are then placed into quarantine. They go through the cycle of getting a date where they can return. They show a clean COVID test and they come back to school. That
So-
has been our protocol the way along. And currently there are 8 students that are out in quarantine because they have COVID. And
So
of those students,
Just to jump
Right.
in, so
Yeah.
the word isolation is for when the students are.
thank you, I apologize. You're right.
And
Yeah.
quarantine is for when you suspect that they might, but you're not sure. and so
Yeah, thank
in
you. Yeah.
Quarantine, you're waiting.
Yep.
So-
So they're in isolation. I
So
apologize.
this graph that I have up here, just so that everyone looking can see, the blue is the isolation. These are confirmed cases. And then stacked on top of it are the additional cases due to quarantine. And so, right now there are 8 in isolation and there's another, I think 6 in quarantine. So a total of 14 students that are affected right now.
Thank you, Dr.
So at
Walsh.
least we're talking about the right numbers and the right cases. And so as you talk about adding in additional new isolation cases, you can see that blue number is going up. And I believe when you say there are 16 total cases, my guess is that if you were to add up each of the new cases in here, it would probably come out to exactly what you said.
Yes, thank you. And I like your graph a lot.
So there have been 8 cases since Thursday at Westboro High School.
and that was my comment and concern that that is a lot to me in less than 2 weeks. And to me, it, while you compare to last year, but last year was masked. And this year, we're talking about flex masking and when to remask. And I feel like we need to pick about a number of cases within a school, the high school or Gibbons. When you hit a certain number in the school, would be a good time to remask. How else can we, other than going on a case-by-case basis, which I don't think is a very efficient way.
Melissa, we can't hear you.
I do understand that having communication about clusters or this or that, but when you're talking about a high school where kids are mixing and mingling constantly, and you have 8 cases within less than 2 weeks, to me, that seems like a time where we should be remasking versus not masking. And I just feel like we should be giving you hard numbers on what we recommend when that is the time to remask, versus, and obviously Gibbons right now, is doing well. And so would we ask both schools to remask? Not necessarily. But in a school where we've seen now 8 cases in less than 2 weeks, not masking, flexible masking, it doesn't seem like a good choice right now.
So yeah, I'm just going to interject that and we've done this a couple times together as a shared committee. I am really comfortable with open-ended discussion and we'll keep going, but I also feel that respectfully, we're not even on the agenda tonight. And once again, we're then down a rabbit hole where we're talking about intricate policy decision where I don't even know if the rest of my board is watching. And we were asked to come and provide an update. So I remain very comfortable discussing this, but I feel like then we're moving towards the development of a motion where we don't have discussion, where I feel like I had the opportunity to come prepared with additional data. So I guess, Dr. Walsh, I would respectfully request that we terminate this aspect of discussion and stick to hopefully the discussion of current implementation. I remain completely respectful to the thought that we're going to look at ongoing data, which means we will have plenty of opportunities to come together and finish this conversation where we participate together in what happens. But I also feel like I want to be honest that like at a certain point, I don't feel prepared around this level of then the next aspect of this discussion. And it wasn't the avenue that I anticipated.
And I agree in the sense, absolutely, that tonight the meeting was about the cases in town and the trends that we were seeing in town, and this is what caused us to want to have a meeting to look at what is happening within the town and to come up with policies for the town, because we got so much feedback about the schools. We wanted you guys present so that if there was additional guidance we could provide you, we could certainly provide that guidance. And I think that is what Dr. Marr is trying to do, is to figure out what guidance the board as a board, while all 3 of us are here tonight, what we can do to give you guidance, because this seems to be so much on the minds of the general public in terms of the sheer number of people that were communicating with the board. And so for us to spend a few moments more to continue to think about what sort of guidance we would recommend. Certainly, if we were to, work one-on-one with you, Amber, then it would be one person on the board working with you, and it would be helpful if they had guidance from the full board as far as what they are or aren't allowed to, use as signposts or guidance along the way. So I don't necessarily want to cut off the discussion too early, but I do realize, Amber, that Superintendent Bach, that you're right, that this is, what was on the agenda was really to talk about the townwide, policies and to then give guidance to those groups where appropriate. And so with that, I don't know, this could be a point where I actually transition a little bit to talking a little bit more about the townwide stuff, unless there's something, Dr. Marr, Dr. Ehrlich, you want to add before I do that?
Just want to thank both Chris and Amber for their participation this evening. I think it's been helpful to have these questions that, many of the.
Dr. Ehrlich, I think you just froze.
Susan.
While we wait for Dr. Ehrlich to come back, I think, Mrs. Vincent, did you have your hand up? Did you want to say something?
I did. I had a question for Dr. Mayer, but my question for her was, so we've had 8 cases at the high school. That's with masking.
Okay,
So
it's,
I'm not, and those 8 cases don't indicate COVID in the high school. It indicates that a student who attends Westboro High School has COVID. I think there's a small difference there. And I'm asking if there's a difference there.
I'm sorry, I don't understand what you're asking.
So maybe
I
if
mean,
I can
it-
try to translate between the two of you. The chair of the school committee is asking whether the fact that we have 8 cases might be different if they were all derived from school transmission versus just reflecting kind of what's going on in the community as a whole. And I think that Dr. Marr, what you were saying was that the rise of these cases in the school, while it might be just relevant to the community as a whole, it's still concerning and alarming that we have so many cases very recently within the school itself, and reflecting the rise in cases in town. Did I translate that right between the two of you?
Thank you, Dr. Walsh.
Sure. Yeah, I agree. I mean, I don't, certainly in school transmission, has a whole new meaning when children are in school not masked or flexible masking. Certainly there's less close contacts from school, I would assume, but.
To be transparent, there was one in-school transmission out of
Thank
80.
And we have 1,191 high school students. And in that same mix, we have 152 faculty. So you're looking at 5 days a week, every day, 6.5 hours a day, 1,300 plus people, and we've had 16 cases. So I would defer to the discussion around Dr. Ehrlich's original context of people can look at the same data and feel like that's successful data or that's problematic data. So I guess to the point of us continuing to agree that the discussion at the table where we're looking at the data in front of us in order to continue to think about what to do is a sound way forward. And I think people look to us for that leadership, and I have confidence that we can return and talk about that. But I do think that Dr. Walsh was hoping as well to, I know, spend some time just, I hope this has accomplished what you needed from us.
I did want to clarify one thing. There definitely seems to be confusion about the Board of Health's last discussion as a board, and I think we were not with you at the time. We did get together to discuss if the school committee went ahead and voted for flex masking against our advice. So it wasn't that we were okay with flex masking starting on December 6th. It was, what were we going to advise, if that were to happen? I just have heard from some school committee members that we were okay with flex masking starting on December 6th, but our discussion was that we were not as a board, or at least.
So
I do think there's confusion, and I can
Yeah.
certainly go listen to the meeting, but
That's how I remember your point, and I will clarify that. My understanding, having been at the meeting, was that we didn't leave with a structured, organized vote. You chose to take no action on vote, but you stated an opinion that you just gave
Thank
as
you.
accurate. Yep, thanks.
Dr. Ehrlich is back on, so he could finish what he was stating.
great. He's on mute though, so he might have to come off mute.
Yeah, sorry. I think all I was doing was thanking profusely Kristen and Amber for their joining us this evening and giving us a chance for us to ask them questions from a public health perspective about both decision-making and current plans and protocols. And all I was doing was saying nice things about the two of you. So I went on for about 15 minutes before I realized I wasn't on anymore. So you just have to imagine all the wonderful things I said about the two of you.
Thank you, Dr. Ehrlich.
So I do want to bring our attention to back to the town though, and that our number of cases that we have in town, we've had 78 the past week, and as Dr. Ehrlich had pointed out at the beginning, that this trend had been going up out of the range where it was kind of bouncing around before to a much higher level now, and it's actually approaching kind of the highest level that we've actually seen here in Westboro in terms of number of cases per day. And so one of the things that I did want to present or propose to the board here was whether we needed to consider a mandate for indoor public spaces, and whether we wanted to mandate masks for that. I know that we've received a lot of comments once we've posted for this meeting. Most of them were related to the schools. There were a couple that were from businesses or people that operate within the town, and but really not lots of feedback. And so in talking with the town manager and other people, even if we come up with a proposal today, the date that we look to implement it might need to be flexible just to give people some time to realize that this is coming. Certainly, if they wake up tomorrow morning and there was a mandate that it creates this swing back and forth that really kind of causes people to not know what hit them next. And so as we move into this next phase to talk about a proposal, I do want to just make people aware that the board is thinking about this. And I don't know what will come of it. I do have a proposal that I wrote out that I can read. Let me just stop sharing what we're doing here so that I can flip over to my screen where I have it written. And so COVID-19 cases are effective in preventing serious COVID-19 vaccines are effective in preventing serious disease. More than 80% of the Westboro population is vaccinated. In fact, it's probably much more than that. New cases of COVID-19 are split approximately in half between vaccinated and unvaccinated persons. Unvaccinated persons are more likely to get infected and spread the virus. The virus is transmitted through the air and concentrates indoors. When people wear a mask correctly, they protect others as well as themselves. Consistent and correct mask usage is especially important indoors. Cases and hospitalizations of COVID-19 are rising throughout the state. In Westboro, we're seeing a dramatic rise in the number of new cases. The number of new cases in Westboro is approaching the largest spike we have seen in the past, despite our high vaccination rates. So the proposed order would be unvaccinated persons continue to be required to wear masks in Westboro public school settings, and everyone continues to be required to wear masks in most municipal buildings. This order is based on the most recent CDC recommendations and current case numbers. To achieve universal masking in indoor public settings, we're requiring that everyone, including fully vaccinated people, also mask in indoor public settings across Westboro. Fully vaccinated people might choose to wear a mask in indoor, non-public settings, particularly if they are immunocompromised or at increased risk for severe disease for COVID-19, or if they have someone in their household who is immunocompromised at increased risk of severe disease, not fully vaccinated, or not yet eligible for vaccination. Masks are required for all individuals in public indoor settings, regardless of vaccination status, including on public transit and in transportation hubs, indoors in K-12 schools and childcare settings, emergency shelters, healthcare settings, local correctional facilities and detention centers, homeless shelters, long-term care settings and adult senior care facilities, indoor public settings and businesses, including retail, restaurants, theaters, family entertainment centers, meetings, state and local government offices serving the public. No person can be prevented from wearing a mask as a condition of participation in an activity, entry into a business, or employment, provided such a person elects to wear a mask that is designed to inhibit the transmission of COVID-19, but that is not designed to otherwise obscure the identity of the individual. For purposes of this order, masks shall include, but are not limited to, cloth masks, surgical masks, and N95 respirators that are worn to completely cover a person's nose and mouth. Exemptions to the mask requirements: persons younger than 2 years old, very young children must not wear a mask because of the risk of suffocation. Persons with a medical condition, mental health condition, or disability that prevents wearing a mask. This includes persons with a medical condition for whom wearing a mask could obstruct breathing, or who are unconscious, incapacitated, or otherwise unable to remove a mask without assistance. Persons who are hearing impaired or communicating with a person who is hearing impaired, where the ability to see the mouth is essential for communication. Persons for whom wearing a mask would create a risk to the person related to their work, as determined by local, state, or federal regulators or workplace safety guidelines. Persons who are actively eating or drinking in an area that is approved for eating or drinking. Persons who are clearly socially distant, i.e. with 6-foot markings on the floor or the only person in a room. This regulation shall be applied in a manner consistent with the Federal American with Disabilities Act, Massachusetts state laws, or any other applicable provision of law. And how would this go into effect? And obviously, all parts of this proposed motion are, subject to, discussion and debate and, even rejection. But to give people and businesses time to become aware of this order, will go into effect Wednesday, December 8th is the proposal. Although all people and businesses should try to implement this as soon as possible. This order shall be in effect. And one of the things that I was proposing here, it's a little bit complicated, but I really wanted to make sure that any order that we put in place has the ability to have it automatically rolled back when things improve. And I was originally thinking that, a threshold of 10 cases per day is where my initial comfort level was. And so this order shall be in effect until daily cases in Westboro have dropped below 140 new cases in a 2-week period, determined by using the numbers published by the Board of Health for 2 consecutive weeks. And this would be an average of 10 cases per day shall be used if the reports do not cover 14 days. And if after dropping below the required level, and this order is not in effect, a subsequent rise in cases above 70 new cases in 1 week, so again, an average of 10 cases per day shall be used if the report does not cover 7 days, shall trigger this order to be in effect on the day following the date the report is published. And what that does is allow us to have some sort of clause in there so that it's very clear what the expectation is, how long this is going to be in effect, and to have it immediately roll back if we start to improve. And then in addition, I am proposing that, and as far as penalties and enforcement, that a violation of any provision of this order is subject to all civil and criminal penalties as provided for by law. Individuals or entities that violate this order are subject to a maximum fine of $1,000 for each violation. And for the purposes of civil penalties, each day that an individual or entity operates in a manner inconsistent with the order shall constitute a separate violation under this order. There are, obviously, I want to open this up to discussion because I have not yet heard any feedback from my other board members on this. This was a proposal that I came up with, modeling it off of various state and other local communities that have implemented town-wide mask mandates. And we can also discuss to, revisit this mandate, at our next, meeting, or, other, or if the cases drop earlier than this. But now that I've proposed this, I'd certainly like to get some feedback from Dr. Ehrlich or Dr. Maher.
Would you like to go first? Or you want me to?
Go ahead, Nathan. Alan, sorry.
Yeah. So before I get into many of the specifics, The thing that strikes me is you're setting a threshold for this being implemented of 140 cases in 2 weeks. And I don't believe we've reached that threshold yet, have we?
Let's see, I think that the past two
Second.
case numbers are not, no, they are,
And so,
but what you've missed though is that there are different enter points and exit points. And so the enter point is 70 cases in a week, or 10 cases per day, within a report, on average. And that's what would trigger us to go into the need to have a mask mandate. To come out of it, to make sure that we're really out, improving, we don't want to come out on a blip, and therefore it would be a 2-week period that we would look at to come out of the mask mandate. And so that's why it would be 140 cases, less than 140 cases over a 2-week period to come out of this.
okay. I think there may be some issues with that implementation. So for instance, just arbitrarily saying, if we adopted this tonight, it got implemented Wednesday, okay? And then let's just say on Thursday, we report 50 cases for the last 2 weeks. So it then ends on Friday. You see what I'm saying? You're saying you don't want to blip to take it up, but if we haven't even reached the threshold, it doesn't take much to have us fall out because you're looking at a 2-week time window. Anyhow, you can contemplate that while I just say a couple other things. Can I share my screen or not? Is that an option?
I believe it is. Give me just a second, and I think I can allow you to.
Yeah.
You should check now and see if you have the ability to share.
Let me just see, share screen. Okay, so what I'm sharing is a site many of you may be familiar with. It's called World Odometer. I'm just going to refresh right now because that will include cases from today. And this is Massachusetts, and it's got it by the active cases. But here are the daily new cases. And a couple of things that I think are worth pointing out. First of all, when we met around the November 15th, this was a time where if you look at the graph, you can see it was unclear where we just sort of bouncing around and what direction we were going to go. And it's pretty obvious that over the last, since we met, case counts have gone up significantly. And if you put a 7-day moving average on that, you can see it's taken off. And, so this obviously is why we had this meeting, and there's concern about what's happening both at the state level as well as in our town. If you come down here, though, and you look at what's happening with the deaths, you can see there's been a little bit of uptick, but the deaths tend to be between about 15 and 30 a day across the state. And the pattern of the graph in no way matches the picture that you're seeing here. And so, I'm going to stop sharing. But my point in showing this is for us to take some of these measures that, will impact virtually every business in town, that would be accompanied by potentially significant penalties. Are we in the same degree of an emergency that we were in a year ago, when not only were we having large cases, but we're having large numbers of deaths also? And that's where I have some concern about having the same level of stringent policies that now as we had then, because the circumstances are not quite the same, even though the cases are rising rapidly.
Dr. Ehrlich, I have a question for you. And I think that this was something that a lot of people had asked me, was when we're talking about, which numbers are the best numbers to use, because obviously people want to frame their arguments based on which numbers they're looking at, whether it be infections, whether it be deaths or hospitalizations. One question I have is, in your experience, with COVID-19, there are, or I'm asking if the long-term effects of COVID-19 might not be represented by hospitalizations or
Sure.
deaths. And I don't know if you can comment a little bit on your knowledge about those sort of long-term cases. And if we're concerned about those, what numbers might best give us that sort of data?
Yep. So there is this condition colloquially called long-term, long haulers or a long-term COVID. And it can have quite a variety of unpleasant long-term effects. What is meant by long-term? Most of these tend to get better within about a year. A year is a long time. So this is not in any way to be trivialized. There are other conditions that have been associated with infectious diseases that have caused long-term symptoms. What is commonly referred to, for instance, as chronic fatigue syndrome, often is thought to potentially have some type of infectious trigger that provokes that. And so with COVID, we know that even if you don't get hospitalized, you can still have long-term symptoms that can include cognitive dysfunction, trouble with your thinking or concentration or memory, fatigue, just not having the right amount of energy as you might otherwise. And you can have other somatic symptoms, which we mean by things like gastrointestinal things, nausea, vomiting, just general discomfort, myalgias, muscle aches. So those are all possible, and they're not well documented. There are studies that look at particular cohorts. We don't really have, at least I'm not aware of it. Maybe Dr. Mayer is more knowledgeable, but I don't think we're aware of just how frequent it is, how often, and what's the average duration. But if people who get it, usually you get it within a month or two. It doesn't have to be immediately after the infection, and it will last typically weeks to months is the time period for that. I don't know if I fully answered your question, but that's everything I think I can tell you off the top of my head.
I think that's more than I could have put on the subject, so I thank you for it.
I do think there's a significant amount of unknown with long COVID. It just, the big unknown and the cases that we are seeing in town right now, substantial amount of children. So that is, something to mention. And, it's concerning. While most children do well, there's still a big concern that a significant amount of children could have long-term ramifications from COVID that we just don't know.
Just make sure you're leaning into your microphone. You're dropping out every once in a while.
Sorry, I need headphones. Obviously, I apologize. No, long-term COVID, especially in children, I think is still a very big unknown. And right now, the cases in our town, significant amount of children. So I do think that that's a big concern. That certainly a lot of residents are worried about.
Do you want to comment about your thoughts about Dr. Walsh's proposal? I'll call it a trial balloon more than a proposal.
Sure. I wish, I am not sure that a mask mandate for our town is needed right now. If I certainly don't agree with the schools being unmasked or flex masking. And I do wish there was another way to have the schools masking without recommending a full town mask mandate. I think it's unfortunate that we're in this position. The discussion about, and I know I'm getting off topic, but the discussion about working together with the superintendent and with the school committee is all in good, but we have expressed our concerns. We have expressed our concerns that we don't think that the school should be not masked currently with the numbers on the rise. And And if there is constant communication and we are not being heard, then I don't see how useful we are as a Board of Health. So I don't know, other than doing a mask mandate for the town, is there anything else we can do? And I know so many residents are asking this question in 170 emails. You know, is there anything else that we can do to
Well, I do want to.
change that? But
I do wanna-
if you want to finish your discussion first, you know, I can bring that up again.
I do want to caution the board not to go with my proposal just to have an effect on the school. That is not what I want at all. I want that if we go ahead with this proposal, I want it to be based on the town and the town numbers and what's best for the town. I really don't want to do anything. And in fact, I would be against doing anything just to try to apply something to the school. I think that we should be definitely applying guidance to the school. I think that we can work with them. I think we can have a good relationship. I do think that the numbers in town are rising, and at some point, if they keep going up, even if it's not tonight, I do think that if the numbers keep going up, we will have to have some sort of townwide indoor mask mandate. I think if the numbers keep going up after that, more extreme measures will continue to have to be layered on until we can get this under control. And so maybe tonight's not the right night for it. Maybe we do need some sort of threshold. I think, as Alan said, we're kind of right around this 10 cases per day, but maybe not even doing 10 cases per day this week. And so, you know, what our trigger to enter into this or to come out of this are probably very key metrics. This is something that, as we start to though get numbers that are equivalent to the height of this pandemic last year, without any vaccine, the ability to, you know, last year we had the ability to vaccinate, you know, 80% of our population still. At this point, we've already vaccinated a huge amount of our population. The cases are still rising. And in many ways, we don't have anything left in our back pocket to pull out to help prevent the cases from continuing to rise or, you know, getting out of control unchecked. And so that's my concern. That's why I, you know, wanted to have this meeting, was to figure out what we can do for the town. We're all trying to, yeah, Dr. Ehrlich, go ahead.
Okay, so appreciate all that you're saying. I have some questions for Jen. We know that Shrewsbury has a mask mandate of some sort. I don't know how, if it's townwide, just restaurants, or what it is, but I don't know if you have any, if you're in communication with anyone from Shrewsbury, who, and perhaps give us some notion of whether they've been able to tell whether it's made any difference or what their thoughts are, their experience. I know anecdotally, some people may choose to go elsewhere if they don't want to wear a mask and they feel like they have to, but I don't know if that's more than anecdote, whether they've observed it in any type of feedback from businesses.
You're on mute, Jen. We can't hear you.
I haven't been able to connect with anyone in Shrewsbury at this time, unfortunately, to give you any data.
Thanks. Do you have, well, I'll put you on the spot again. So we have half a week under our belt since the last report. How are our numbers looking?
So we're at 23 since Friday.
Okay.
I'm sorry, no, 25 now.
Okay.
And that's answers your question.
It does. It does.
Ray, did you have your hand up? No. And Christy, you've been very quiet. I don't know if there's anything that you want to contribute to this discussion. I do want to make sure that you get heard, especially as we start talking about kind of the whole town.
Thank you. You know, I think when you're talking about the full mask mandate townwide, you know, I know that the numbers have gone up quickly, but I think the discussion has gone from we're doing really well to this now all of a sudden this townwide mask mandate. And so, you know, I'm just not sure that the whole community has really seen this coming, this conversation coming beyond sort of what's been going on at the school level. you had said that you weren't sure what other tools you have in terms of stopping the spread. And I know that a tool that you have used with the select board throughout the pandemic is the issuance of an advisory. I think that your engagement with the community has been really strong, and people are really listening to these meetings and listening to your guidance. And so I do think that, some sort of advisory would actually yield some of the desired results in terms of letting people know that there's an increase in cases. And so people who, feel comfortable masking would want to be masking.
I mean, one thing that we could do is, instead of setting that entry point to 10 cases per day, we could, look at it in terms of where we were at the peak of last year, which I think was right around like 12.5 cases per day. And so we could put this proposal in place, and it would not actually have any effect yet, but it would get triggered once we've crossed this threshold of 12.5 cases per day within a week. And that way people could see it coming. And if our cases go down, then, it would actually not go into effect. I think that both Dr. Ehrlich and Christy, both of you had raised your hand.
I'm going to defer to Christy because I'm sure she's going to say the same thing I am. Go ahead.
Maybe that, I guess that's sort of reminiscent of the way it was with the state when we were sort of all watching to see what color we were. Are we red, green, yellow? When Westboro went red, there was an entire toolkit, lots of communication from the state on what exactly that meant and how we were going to move forward. And so it seems to me that if it's going to be based on some sort of number and kind of go on and off, I think there's a lot more work to be done around what that is going to mean for the community.
So you said it in a somewhat different way, but what I was going to say is, I think the idea of having these sort of automatic triggers that go on and off can lead to a very chaotic feeling that I think at some level we need to be deliberate about, okay, there's a problem and we are going to take action, and then we send the all clear signal. And especially when you have and I don't mean this in a negative way, but just in an absolute way, an arbitrary threshold. Okay. Any threshold is going to be arbitrary. I'm not picking on the one you've suggested. But if you have numbers that are bouncing around that particular threshold, then you may find that we're on, off. Whereas if we were managing it as a deliberative body, we would say, okay, well, we were at 150 last week. We're at 139 this week. Okay, we need a couple more weeks before we just say that, because we all know that there's going to be noise in the data. And so I'm reluctant to have some sort of automatic trigger, because I think for the businesses, it's going to be really hard for them to be constantly knowing when was the last time the Board of Health made a new declaration or whatnot.
Yeah, I mean, we sometimes get criticized for the opposite as well, which is that people don't know what's going to trigger the board deciding one way or the other. And so to kind of have some concrete guidance as far as what it would take to cause us to be concerned and what would cause us to no longer be concerned, I think is actually really important. And I think it's really useful for a lot of people that are looking to us for guidance. I look at our current numbers and I am concerned that we're not where we should be. Having 10 cases per day to me is alarming.
So I'm all for transparency. I have no objection to that. I'm just saying there's also some value to consistency.
So, well, I do agree with you, Nathan, that 10 cases a day is alarming, and 78 cases, last week is very concerning. I mean, I would, and I agree with you that people do like to know, to know numbers, hard numbers, when we would do something like a mask advisory or mask mandate. I mean, I do think 10 cases a day, consistently should warrant it possibly, but we have 1 week. So I would recommend that we continue to watch and maybe make an advisory as of now, and we watch until the end of the week and see where we stand. But I definitely, I think we should start with an advisory versus a mandate.
Dr. Walsh, I would be happy to also, if you want to do a advisory statement and ask people to raise their awareness, I'd be happy to push that communication to families. We do reach a broad array of people. If you wanted to put a communication together, again, we remain very committed to collaboration and shared decision making, and we have reiterated that, and we will be at the table with you. I would be disappointed if it looked like, you know, it becomes arbitrary, random, that, you know, we're talking about the town, but it's really about the schools. Like that was just directly stated. It makes me very, very uncomfortable. I have to be transparent.
No, and I think that we could certainly leverage the schools a fair bit to get across some of the Board of Health's, you know, opinions. And so I think that if we were to do a advisory and having that, you know, be pushed out through the school connections, just so that they can reach the large number of people that they can reach, that's always been a concern for the Board of Health, is that when nobody watched our meetings, it was very hard for us to communicate things outwardly. Maybe that's not as much of a problem right now, but I do think that not everybody can tune into, you know, such a long meeting and understand what's going on.
And I think around collaboration of Board of Health, I mean, the schools are part of that actively in terms of all the things we do to both educate, monitor, and care for students and families. So it's within mission, and clearly we're comfortable to share those communications working with you and the director.
So I would propose that we craft some language, well, not at this meeting. I'm going to suggest that, Nathan, if you want to do it, or you want to appoint either Dr. Mayer or myself to work with Jen to craft some language, it can be circulated to the other board members before going out, but that basically has two purposes. One is to act as an advisory that alert people to the fact, if they're not aware of it, that even here in Westboro, where we're highly vaccinated, case counts have been rising, and this is an area of concern to the Board of Health. And then the second piece is educational, which is, here are steps you can take to try and keep you and your family as safe as possible. That you know, getting booster vaccines, wearing masks in certain situations, or whatever the educational component is going to be, the various steps, and that we then collaborate with both the school department to get that message sent out to all the families that are part of the school, as well as our other ways of communicating, whether it be social media or the town websites or things like that.
I have to agree 100% that an advisory is probably our best avenue at this time.
Good.
I-
Oh, go ahead.
I mean, it just to me seems a bit like a mixed message if we just started flex masking in the schools. So on one hand, you know, as of today, we've told people, students, that they don't, if they're vaccinated, they don't need to wear a mask, but then we're going to issue an advisory recommending indoor mask wearing. So I do think there's that concern that we're sending mixed messages. I mean, I do think an advisory for indoor masking is a good idea at this point before we initiate a mandate. And we should set a time to revisit. But you know, it's a little confusing to me to have the school push out this message after initiating flex masking today.
I would say I'm happy to help craft the message that threads that needle. You make good points. What I would say, though, is, first of all, you know, we're talking about flexible masking. If, in fact, the emails we got reflect the attitudes of parents in general, which they certainly may, then I think you're going to have 90% of the students masking anyhow, even if there's flex masking. Okay, fine. I think it's extremely important. I know Kristen has left the meeting, but you know,
She's listening.
Oh, she's listening. Good. Okay. It's extremely important. One issue that did come up in some of the emails that we have to get across here is that it is perfectly okay to wear masks. Just because there's flex masking doesn't mean don't wear a mask if you're fully vaccinated. There are people who may not have a full medical condition in the way that Nathan described, who are more comfortable not wearing a mask for whatever reason, and they should be allowed to, if you're following the school committee's guidance there in a way that is not, in my mind, contradictory with the message that if you are worried about COVID, masking is one more step you can do to help to protect yourself. So.
Yeah,
Also, sorry.
I was
I
gonna
also,
say,
can I,
to follow up, Dr. Marr, with your question about how can we say both things at once, and in many ways we have flexible masking in our retail spaces in town, right? People can choose to wear a mask if they want. They don't have to. I think the Board of Health has consistently said that wearing masks help reduce the transmission of COVID-19. And I think that now we're all saying that in public indoor spaces, wearing of the masks is advised. And maybe I'm misspeaking in terms of the two of you, so please jump in. But I'm thinking that a strongly worded advisory that comes across as saying that we advise the wearing of masks in all public indoor spaces, and that this will help to bring our numbers down so that we don't have to put in a mandate. Hopefully we'll encourage those people that are on the fence to wear a mask. The other thing that I would want to include in any sort of outgoing messaging is to combat some myths that might be out there. There's a lot of people that feel that because you don't wear a mask 100% of the time, wearing a mask sometime is not important, or that if your mask is not an N95 mask, then it's not a real mask and it doesn't count. And both of those are just untrue. These are layered approaches. The more you wear a mask, the more protection is provided to you and to others. And that even if you don't have access to a N95 respirator mask that's been fitted in a certified way by a medical professional, there are benefits to wearing other types of masks. And those benefits increase with how well fitted it is. So masks with a nose bridge that fits around the nose might be better than a mask that is just really loose. But even a really loose mask that covers your nose and mouth is still better than wearing the mask around your wrist or around your neck, or not having one at all. And that just because it's not as good does not negate the fact that there is still some protection. And so I think that there really needs to be that sort of educational purpose that goes out that describes the abilities of masks. And I don't want to say that masks are more important than vaccinations. Vaccinations are also important, and we've done really well with vaccinations. It's just that vaccinations you can do and then not have to worry about being vaccinated for a while, whereas masks are more of a daily issue that you have to worry about.
My only comment in response, Nathan, is I don't think it's a good idea to send out a message that amounts to, we're advising you to wear masks, and if you don't, and the cases go up, then we're going to put in a mandate. I think combining those messages in an alert, an advisory, an educational thing will cause a backlash in a way that undermines the good we're trying to achieve. The fact that we may do that is true, but I think in my experience, if you take that approach with most people, they're going to be put off by it more than they're going to say, oh, gee, they're really serious and they mean it this time. I don't know. I'm open to other inputs on that. I may be a sort of a naive person, whatever.
I think most of us are more scientists than people sometimes. So I don't know how well it will be received or not. And so I look maybe to our director of public health, who interfaces with the public a whole lot more than I do, to maybe help give us some guidance, or Melissa, if you have some input as well.
I mean, I agree with Alan. I do think just the mask advisory, and then us as a board revisiting once we have more numbers, and if we do see that 10 a day number, then we do need to revisit it. I'll leave it at that.
I
So-
agree. I do think that it is wise to look at where the data is bringing us. And it also, I think it does transition easier if we do decide to go with a mandate eventually, if we get there. So I think this is definitely the right avenue for people to listen to as you're taking.
So I think that probably what we'll want at this point then is a motion to put out an advisory so that we can vote on it, and it will be very clear where all three of us stand on that motion. I think as far as my motion to have a mandate at this point, I do not believe it was seconded, and so I think that therefore the motion fails. So if we have a new motion for a vaccine advisory from the Board of Health.
Vaccine and mask
A
advice.
vaccine and mask. Sorry, yes, I'm looking at the wrong word on a page.
So if I can, I'm happy to make the motion if you want me to.
Yes,
Okay, so I move that the Director of Public Health draft a advisory to be sent out through the school system and through the town's other means of communication that advises the residents of the increasing rates of COVID-19, the concerns about COVID-19 that are associated with that, and has an educational component as well that includes what citizens and what residents can do to help protect themselves from contracting or spreading COVID, to include encouragement of vaccination, and also the use of masks in indoor settings, regardless of vaccination status.
and do we have a second on that? Melissa,
second.
we could hear.
Yes.
Okay. Unless there's more discussion, I'd like to take a vote. Not hearing any more discussion on that. We have to do this by roll call. So Dr. Ehrlich,
Yes.
Dr. Marr,
Yes,
Dr. Walsh, yes. So very clear guidance as to where the Board of Health is on that issue. I think now turning back once again, we still have Amber and Kristen here. As far as guidance for the schools, they've been very receptive to working with the Board of Health to help them figure out and navigate kind of on a day-by-day basis. Whether special policies need to be put in place on a either by room or by school decision. And so this sort of consultation from the Board of Health, I think, will be really useful. And the question is, what kind of guidance can we provide them? Is this something that, myself, Dr. Ehrlich, or, Director Sullivan or Dr. Marr, who should be responsible for kind of being the point person for working with the school department? Obviously, all three of us as board members can't do this without this being a recurring meeting. And so while we think about that, we then also have to think about, when do we want to next meet as a board? Unfortunately, we were hoping not to have to meet lots in December. I do think that at this point, it's looking like we're probably going to have to meet more often.
Can I make a comment about our last vote for a second?
Yes.
Because I think this is really important, and people may wonder, okay, Ehrlich, he's all over the place. Who knows what he thinks? When we make an advisory like we are doing, we are looking at things from a public health perspective. Okay, we have one lens, public health. That's it. Okay, it's an advisory because people have multiple factors in their lives that they will take into account that we don't understand for each and every individual. And this, to a certain extent, is where the school committee was coming from, which is, okay, we understand your health concerns. We have other concerns. We have reasons for what we want to do. We are doing this. Okay, those two things are not in conflict, that we can issue an advisory and still work with the school committee within the context of the decision that they have made. And unless one of you two want to disagree with me on this, I just want to publicly state that I don't view that there's an inherent conflict, that we have a certain perspective, we have a certain area of responsibility, and other groups in town have areas of their responsibility and areas of and their own perspectives on things. They're not always completely aligned. That being said, as far as working with the school committee goes, my advice is it'd be nice to have some type of collaboration where we're able to discuss the numbers, the trends in the numbers, either perhaps Nathan, you going into their meetings or having Kristen attend our meetings, whatever is most easiest. And obviously Superintendent Bach is the bridge along with Jen Sullivan, the two of them collaborating as well. But I think, the message has to be, we will watch the numbers closely and continue to give feedback and input as to whether we are detecting worrisome trends.
I mean, I would recommend that there's a weekly kind of touch point there between the two. And how that would happen, I'm not sure, whether it's, I'm sure, I know, Jen, you're talking more than weekly, but.
Yeah, just to echo that, Melissa, and to agree with you, we have a protocol where we produce both daily and weekly numbers, and we submit them, we post them, and we also interact with Jennifer. And if we feel we need to also, then she can share that ongoing data with you. But typically the nurses know when they want to flag calling and checking, and we then ask to have a consult with one of you. And typically, like last year when Dr. Ehrlich was chairing, he volunteered. It's kind of who's available by phone that we get someone and we get advice on certain pieces. And if needed, then we would convene a meeting. I feel like we have a good protocol for circling through that. I would suggest that we maintain it and not come up with something new, but adjust it if you see it needs to be adjusted as we move forward.
I do think we're at a place where we know more about what to do with cases. My conversations with Superintendent Bach and also the school nurses happen regularly. And I think that my conversations with them and my guidance is probably enough for 90% of what happens in the schools. So maybe that extra, if I see the numbers going up further, or if there's a cluster or something in that end, then I involve the board. I think that's something that you guys should look at as well. So it's not taking up your time when answers can be simply giving through me. Just something to think about, because we are communicating regularly.
So my question and concern would be if the time came where you or one of us felt there was the need to remask, does that have to come to vote again? Because to me that that seems inefficient and kind of, and I don't like that word inefficient. I take that back. That's my question is, how is that going to happen? If the guidance is that remasking happens in a particular school, how is that going to happen?
So, I feel like we're circling through conversations again. I'm going to respectfully ask that we try to finish. My earphones are dying here. I'm trying to circulate them through. We have been at this since 5:30. I feel like we have a good action and we have a commitment to be in front of you to share data and make decisions. We share the health and safety messaging for our students and are equally committed to that. And I can promise you that you have a director of a board of health who is your direct conduit to us, who can call us forward to review the data with you in a working meeting. We would not sidestep that and we would come to the table. I have confidence that we received incredibly good guidance from you over the last year and a half around what to do. And at the transition where we've had one discussion point that diverged, it does not represent the whole of our work. And so I feel very good about where we are, but I would respectfully ask that we try to at least terminate this part on the schools, because I'm starting to get tapped out. just being honest.
No, I agree. I think we're all getting a little tired. So
Yeah, I think productivity ends at a certain point, and I'm feeling like, I'm feeling anxious that at this point we've covered this ground multiple times. I feel very good about the actions we're leaving with, and I have confidence in us that we remain in strong partnership with you.
So if Director Sullivan was the one that was the key point of contact there, which she has been in the past, and I think I would recommend that she continue to be. And if there is anything that is of note that needs to be brought up, she can certainly bring it to my attention. And if the two of us talking together decide that we need the full board, then we can certainly convene a Board of Health meeting. I think we'll try to keep a 48-hour notice so that we can get public comment if needed, but also to give people time to realize that a meeting was happening. Obviously, if there was an emergency, we still could avail ourselves of the emergency powers of the Board of Health to sidestep the open meeting laws, but we'd only want to use that if it was truly an emergency. So I think you're right, Superintendent Bach, that I think we've given the guidance that the school needs, and I think that we're going to continue to do on a much more fine-grained, detailed level on an individual basis with Director Sullivan. And so I want to just see if there's anyone else on the board that needs to make any final comments before we conclude the meeting, but I don't think there's any additional comments that I need to make. Good, I appreciate both Kristen and Amber coming to our meeting. I know that we've pulled you away from all the other stuff that you were planning to do tonight, and we do really appreciate that. I think that this is, a testament to the open relationship here. I want to thank all of the members here on the Board of Health for all of their continued hard work. And I do want to put a shout out to those nurses that have been working tirelessly as well. And to all the community for giving us lots of guidance. So thank you.
I move we adjourn.
I second it.
All in favor, Dr. Ehrlich?
Ehrlich, yes.
Mayor, yes.
Dr. Walsh, yes. Thank you, everyone. Have a good night. We appreciate it.
Thank you.
Good night.